We are focusing on schizophrenia spectrum disorders, a topic the NCLEX will test by assessing your ability to prioritize safety, differentiate symptoms, manage medication side effects, and use therapeutic communication. The exam will frequently require you to distinguish between positive and negative symptoms. A simple way to remember this is that positive symptoms are things added to a person's experience. These include hallucinations, which are sensory experiences without external stimuli, and delusions, which are fixed, false beliefs. For example, a patient might have a persecutory delusion, believing a government agency is plotting against them, or a delusion of grandeur, believing they are a powerful historical figure. A classic, high-priority exam question will involve a patient experiencing command auditory hallucinations. Your immediate nursing priority is always safety. You must assess what the voices are telling the patient to do, as this presents the highest risk for self-harm or harm to others. In contrast, negative symptoms are capabilities that have been taken away or reduced. This includes a flat affect, where there is little emotional expression, alogia, which is poverty of speech, and avolition, a severe lack of motivation to complete purposeful tasks. A common exam trap is to misinterpret avolition as simple laziness. The correct nursing approach focuses on building a therapeutic alliance and using clear, direct communication to encourage participation in daily activities and establish a structured routine. Cognitive symptoms are also key, such as disorganized thinking, which becomes evident through speech. You might see exam questions asking you to identify word salad, a jumble of meaningless words, or clang associations, where the patient chooses words based on their sound rather than their meaning. When it comes to pharmacology, you must know antipsychotics and their severe side effects. The NCLEX heavily tests extrapyramidal symptoms, or EPS. You can remember the main types with the mnemonic ADAPT, which stands for acute dystonia, akathisia, Parkinsonism, and tardive dyskinesia. Acute dystonia, a sudden, severe, and painful muscle contraction, often in the neck or face, is a medical emergency. If you see this, you must intervene immediately, typically by administering a medication like benztropine or diphenhydramine. Akathisia is a state of intense inner restlessness where the person cannot sit still, which is incredibly distressing and can be a suicide risk. You also need to monitor for metabolic syndrome, a cluster of conditions including weight gain, hyperglycemia, and hypertension, especially with atypical antipsychotics. This leads to challenges with medication adherence, as patients may stop taking their medication due to these unpleasant side effects. Therapeutic communication is another critical area. The golden rule is to never argue with a delusion or directly challenge a hallucination. If a patient says, "The spies have bugged this room," an incorrect response is, "No, they haven't." The best response, and the one you should select on the exam, focuses on the underlying feeling. You would say something like, "That sounds very frightening. Let's work together to help you feel safe." This response acknowledges the patient's fear without validating the content of the delusion. If a patient is actively hallucinating, you can state, "I understand you are seeing something, but I do not see it." This presents reality gently while acknowledging their perception and building trust, which is central to the recovery-oriented model of care.